so far it's going spectacular in terms of turnout of volunteers. It's been tremendous. And over 1,200 Arkansans have shown up today to help other Arkansans get access to health care. It's amazing. I was just, my wife Shanti and I were registering patients in, and 244 patients were registered in the first 40 minutes after the doors were open. 244. Okay. 40 minutes. Which is just incredible. I think you can see this is very orderly and it's very respectful, to people. They all have individual attention and privacy, concerns are met. Just in terms of talking with the folks coming through, the registration, just to give you a smattering of it, and we'll have more statistics later, comprehensively of what's going on. But,
right.
I saw someone who hadn't seen a doctor in 5 years. Other folks that are recently unemployed and lost their health insurance when they lost their job. There's just a really compelling need here, and I'm very, very proud of the Arkansans that have stepped up to help. I mean, we put out this request for volunteers just a few weeks ago, and to have 1,200 people give up their Saturday when it's there's a Razorback football game going on right now, and when it's the first day of duck hunting season, I mean, it's incredible. And the folks are enthusiastic about it, and they're cheering. It's great.
Okay. How long have you all had to organize this whole thing?
It's just a matter of weeks, actually.
Okay.
Yeah. And we've had more than 25 organizations from Arkansas, Health. All of the different hospitals in Central Arkansas have been part of it. The Nursing Association, the Medical Society, a number of church groups, certainly all of the free clinics in the area, as well as the State Association of Free Clinics. It's just been a tremendous outpouring, and these folks have worked to get volunteers, they've worked to get the word out to patients. It's just really been a remarkable team effort, completely nonpartisan. All kinds of political viewpoints are represented here, and everybody checked them at the door. It's just terrific to see what can happen when people put their differences aside and focus on helping Arkansans.
And what do you hope these patients will get, once they leave? Obviously, this is a one-time clinic.
Right. Well, what we're also seeking to do is to link them to follow-on care. So at the end of their examination, as they depart, they're being directed to information booths and tables that have the information they need about clinics here in Central Arkansas. If they need further direction in terms of specialty, or if there's something going on where they're going to need follow-on care, they're getting information about that. Prescriptions are being written for these patients as well. The physicians are trying to do that with generic prescriptions so that they are as inexpensive as possible. So there's a lot going on here. I have to say, the National Association of Free Clinics has done a phenomenal job with this. We kind of joke about this, this hardy band. There's basically, in the main here, just a handful of folks who have come together from outside of Arkansas to link up with all the volunteers in Arkansas, and they've put this together in no time. This 80,000 square feet, for example, I don't know if you were here last night, but this 80,000 square feet of space last night was not opened up to them until 8 o'clock at night. And to have Arkansans come in, set all this up, get this all done, and have this work as smoothly, as it does, it's incredible.
Okay.
Lieutenant Governor Halter, hi. I'm going to speak to you again later, but I just want to say that Nicole Lamoureux, who runs the National Association of Free Clinics, has said many, many times, without you, this wouldn't be happening. And so you should take a little credit for making this happen. Because
I appreciate you saying that, but Nicole
she brings,
terrific.
When she talks about you, her eyes fill with tears.
Well,
with what Lieutenant Governor Halter has done. I just wanted to add that, because you're being far too modest.
No, this is really about the 1,200 plus Arkansas volunteers that have come in here.
Right.
Look, I'm an elected official. I get paid to do this, right?
But you
These
did
folks
you
are
went out of
volunteering.
you went out of your way to make this happen.
Well, I appreciate you saying that.
And I don't mean to, but I want to. You mentioned that this is nonpartisan, and that's true, and that's great. But there's something very important happening in Washington D.C. tonight, and I want to ask you, Lieutenant Governor Halter, what would you like to say to the 100 members of the United States Senate who are going to be voting tonight on the first stage of the health care bill?
Well, there's a lot to say, but I'm not going to say it here.
Okay.
We have, as a group, decided that this was going to be a nonpartisan event, that this was not about politics, that we were not going to deal with political issues here. There will be plenty of opportunities, I'm sure, for folks to ask me about that in other venues, and I'd be delighted to talk about it. But this focus today is about providing medical care to uninsured individuals in the state of Arkansas that have come in for that care. I believe we're going to see at least 1,500 Arkansans today, based on the number of patients that have registered and the number of walk-ins that are there. And out of respect for the vast array of groups that are helping and volunteering, I'm going to keep my political opinions to myself while here.
But I'm going to guess that you're going to be watching the television and hoping that there's a successful vote tonight when.
I will say that.
Okay, thank you very much.
I will say that.
Thank you
Absolutely.
very much. Thank you.